Hi, my name is Nishama Marcus, Director of Social Work, and thank you so much for joining us today for Estera's Compass program. We aim to provide monthly lectures on topics to help you navigate cancer and non-malignant hematological diseases. Today's topic is tips and tricks for disease-related anxiety. Before we get started, a few housekeeping items. This program is recorded and will be posted to our website. There is no need to jot down everything you hear today like you did in high school history classes. Please feel free to be present. We will have a question and answer section at the end, which will not be recorded. If you're uncomfortable asking questions at that time, please feel free to submit your question in the chat, or you can always email us at social.work@esterahealthcare.org. Okay, so here we are. I'm just going to start it from the beginning. Okay, so here, that's me. What is anxiety will be covered today, some common symptoms of anxiety, how to notice in your body where anxiety presents itself, how to identify triggers, what's considered normal triggers, non-disease related and disease related, how to notice signs and how to notice the cycle, typical responses you may have, which I consider to be maladaptive or unhelpful, some new tips and tricks, and we'll have a question and answer section at the end. Okay, so what is anxiety? Anxiety is persistent feelings of nervousness or panic or fear that can be intense and for some folks can be excessive. Anxiety is meant to protect us. It's meant to help us with what's called perceived danger or threat. It's something that we think may or may not happen, but we anticipate it's happening. Anxiety can be normal and it's expected in some situations. So, for example, going on a first date, you get that jitter in your belly when you public speak, like me, or for all of us when we experience the pandemic. It's a shift in our routine. So it caused us to feel a little anxious, or for some of us, a lot anxious. So according to the DSM, anxiety is what's considered to be excessive worry. So it's beyond that normal. So most people have some type of anxiety, but almost 1 in 5 people in the US experience this persistent and excessive worry. It occurs more days than not. It typically lasts at least 6 months to be categorized in the anxiety bucket. And typically a person worries about a lot of different things. So I'm going to put phobias to the side for just a moment, because phobia usually means that there's anxiety about one particular thing. People with anxiety typically struggle with more things, like it could be work performance or their children's health. Folks worry about the weather or how they're going to get to work. They worry about financial issues. It encompasses multiple aspects of their life. Anxiety is typically measured by 4 buckets: frequency, how often it happens, intensity, how extreme, right? How it makes you feel, duration, how long it lasts for, and how it impacts your day-to-day functioning. Anxiety symptoms are categorized by physical. They can impact physiologically and behaviorally, and we'll get to all 3. So here are some physical symptoms of anxiety. It can impact your heartbeat, your breath. It can impact some people feel dizzy, or it can impact that feeling of stability, that your feet are somehow no longer on the floor. For some folks, it's sweating profusely or having headaches. For others, it's dry mouth, that feeling of discomfort or facial preoccupation, like like this. For others, it can be gastrointestinal. They could have stomach pain, nausea, diarrhea. For others, it affects them like body aching and muscle tension. Some folks, it affects their sleep patterns. You might notice that you sleep more frequently or less frequently. And for others, it's changing in eating patterns. In terms of physiologically, for some folks, it's that uncontrollable worry that they feel like they can't get a hold of it, and it makes them feel more and more out of control. For other folks, it's irritability, that feeling that they just can't feel settled and everything makes them upset, which leads to impatience, right? That more and more people are disappointing you and you're noticing it. You might feel on edge. You might feel that tension. So a lot of folks talk about difficulty concentrating, that it's difficult for their mind to just rest. Sometimes their body has difficulty relaxing, which causes fatigue. Some folks have nightmares or very vivid dreams. And some it impacts their memory, their ability to recall information. Usually that has to do with concentration, that they're so distracted that they can't focus on what's happening in the moment. So they end up not being able to remember, the details of the event. For other folks, it's behavioral, and these aren't, mutually exclusive. You can have, several from each of these categories. Behavioral usually means that when you feel anxious, you might want to avoid people, you might want to avoid places, things or different situations make you uncomfortable. And that might have phobic behavior. You might be super distressed, panicky. A lot of times people will tell me that they feel panicky. You might have obsessive compulsive behavior, that needing to constantly tune in and check yourself about this anxiety and why it's making you upset and what's making you upset. Or, did I check this? Did I clean this? Did I speak to the person I needed to speak to who I'm anxious about? A lot of folks talk about mind reading, anticipating what other people are going to say or do, anticipating things that have not even happened or haven't happened yet. I hear that word yet. It often leads to universal verbiage, that all or nothing, black and white thinking. So for example, somebody might say to me, my daughter didn't call, so I'm just not going to call her until she calls me. That's all or nothing or black and white thinking. Or all doctors are bad, or I'm just going to quit my job. Let's go back for just a moment. Okay. How does it manifest in your body? It's very important to feel and listen to the way that your body is noticing that anxiety. It usually occurs the same every time. So a lot of times people don't know how it manifests, but once they pay attention to it, they begin to notice it. And that's what you want to have happen. You want to be able to anticipate how it manifests so you can identify it in the moment or even before it's happening or as it's happening, and then you can implement that coping strategy. Here are some triggers, and we'll get to them in more detail. So here's what's considered normal or typical triggers. Most people have anxiety about like medical issues. Did my doctor hear me? Did I communicate everything I had anticipated? What's this bump on my arm? I haven't seen it before. A lot of times people have anxiety about relationship issues, that my partner didn't listen to me. Am I going to meet my person? Are my needs going to be met ever? Folks have triggers with financial concerns if they're concerned about job security. When's the next bill going to get paid? They get anxious about family stress. It could be a grief or a loss. It could be a caregiving issue. It could be a pending breakup or divorce. Some folks get triggered by work or school stressors. Is my teacher noticing my work? Am I going to get a good grade? Is my manager or supervisor going to acknowledge me? Am I going to feel purposeful? A lot of times people have triggers about change. It could be a change in routine, like waking up the same time every day. A car breaks down, that changes our routine. A change can be a new person, like meeting someone new. Sometimes people have a lot of anxiety about new social situations, being in a new group space, having a new plan. A normal trigger can be some type of disaster, whether it's man-made or a natural disaster. Sometimes people have anxiety when it comes to body changes. I gained 10 pounds and now I'm anxious about that, or I lost 10 pounds and I'm having my insurer and nothing's working, right? Sometimes people are anxious about socializing or interacting, whether it's one-on-one or in a group setting. Sometimes people are anxious about performing, that concept of performing. I have to give a presentation. I have to meet my work expectations. Are they going to notice me at school or work? Some people get triggered by isolation. This is a big one. It could be geographic isolation, like my family lives in another state, and I'm worried that they won't be able to reach me. It could be social isolation, like I recently had a surgery and I can't leave my home, and my friends can't visit me, or COVID because friends can't visit me. It could be technological isolation. Everyone's participating on Zoom and I don't know how to use it. It could be social media that I don't know how to use the platform. It could be I was blocked by somebody. And it could be feeling just marginalized by your peers or by your coworkers, that concept of feeling like the other. Sometimes people feel the opposite about crowds, that not that they are being excluded, but that it's so confining for them. They don't like that feeling of being in tight spaces. Some people are triggered by feeling unprepared. So for example, for this presentation, I had to get quite prepared because I don't like that feeling of being unprepared. And so for some people, it's fear of the unknown. It's not knowing what comes next. My doctor told me that I have a lab work next week, but then what? So these are considered normal triggers. Now let's add on disease-related triggers to normal triggers. So if I typically have anxiety about medical issues, and now I have to add on, 5 more appointments, right? The office itself might serve as a trigger. Waiting for a lab result would serve as a trigger. Waiting for my doctor to call me might serve as a trigger. Lab coats might serve as a trigger. Logos might serve as a trigger. So as you can see, it's disease is quite an add-on to already existing anxiety. Let's take relationship issues. If you're already anxious about your relationship and now you have a disease that adds strain to the relationship, right? Because now it might be that somebody who you don't like to spend time with anymore is now responsible for taking you to appointments, or you might be relying on them to help you around the house. There's financial concerns normally. Well, now there might be more disease related because now you might have co-pays, or somebody might stop working. There might be loss of income or change in income. There might be family stress before, and now with some type of disease, there might be a fear of loss. What's going to happen to this person after I pass, or if you're a caregiver, what am I going to do? If I lose this person, even if there's no necessarily terminal illness, it could just be that your mind moves in that direction. It might also lead to change in dynamics and roles. There might be somebody who is typically a breadwinner that's now responsible for being a care recipient. There might be somebody in the family who was typically a care receiver who's now serving as the caregiver. In the past, if you had work or school stressors, now there might be added pressure. There might be pressure to return to work. There might be pressure to retire or go on disability. Or you might be expected to perform more because now you're supplementing income. So instead of working one job, you might be working multiple jobs. For folks who are typically anxious about change, disease adds quite a bit of change. Change in your routine. There could be change in, we had mentioned like body and appetite. In terms of socializing or interacting, if you typically have anxiety, meeting new medical professionals might serve as a trigger. You now have to meet a new medical assistant. You now have to interact with the front desk. You now have to interact with, multiple new doctors or nurse practitioners. If you typically had anxiety in the past about performing, right, you might have anxiety about the pressure to improve. So I hear a lot of folks that go from hospital to rehab, and they only have 20 days in the rehab facility covered by Medicare, and they're feeling really anxious that there's a pressure to improve. Otherwise, they go home without, support in place, or they might feel that they don't have what they need at home, which can add anxiety both to the patient and also to family members to try and put everything into place quickly. In terms of isolation, sometimes there's the isolation for medical necessity. So for example, if you're immunocompromised and now you have to be, home during COVID and everyone else is kind of loosening up a bit, but now you're still isolating. Or there are some folks who have, other breathing issues and they just can't risk it. It could mean that you're prone to like infections. So you can't be out in public or in confined spaces with folks. If you typically have anxiety about tight spaces or crowds, and you're adding the medical anxiety, you might be adding the tight spaces and crowds in exam rooms or in hospitals, in elevators. You might be sharing rides, going to the hospital, or sharing rides in public transportation, or having folks drive you where you might in the past have driven yourself. In the past, if you had anxiety about making decisions, we'll add on the additional, stressor of making healthcare decisions, which are, impactful, meaningful, and require a lot of consideration. If you had anxiety in the past about feeling unprepared, disease-related triggers often include like side effects, things that you might not be prepared for, or conditions you might not be prepared for, functional decline, changes in prognosis, the variability of treatments can be triggering. And I had mentioned fear of the unknown before. We'll add disease related. A lot of times patients will say to me, well, I don't know what to expect next week, or what am I supposed to expect next month, or do you think I'll be okay in a year? So that includes fear of the unknown. So this is a point where we notice the cycle. Typically an event happens, which can be like a diagnosis or a hospitalization, and it makes us feel some kind of way. The cognitive triangle means that your feelings don't necessarily have to impact your thoughts or your behaviors, but they often do. And I'll give you some examples. So in terms of our feelings, we can be feeling anxiety, we can be feeling angry or resentful, we can be feeling irritable, depression, we can feel shame or guilt, that maybe I could have made better choices, things like that I hear. And it moves into thoughts, whether it's panic or irrational thoughts, that I'm never going to get better, things are never going to be the same way. It can also move into behaviors, like making poor choices, or sometimes I tell folks that if you don't make a choice, sometimes you're actually making one. And it's important to note that by not making a decision, that is in fact a decision. Some folks, who feel anxious tend to isolate more, or avoid talking about it. Some folks have extreme negative self-talk, that something's wrong with them. I hear that a lot. Something must be wrong with me. Sometimes it can lead to alcohol or substance use. Sometimes it can lead to placating other people, making healthcare decisions for their family members or their friends because they don't want to disappoint further. And sometimes it can lead to a patient being accusatory or combative, with their family or with their friends. So these are what I consider maladaptive responses, right? If you look back at that triangle, it's how do your feelings impact your thoughts and behaviors. So a lot of times people will say to me, oh, I can handle it myself. I'm doing just fine. So the question I like to ask is, are you surviving or are you thriving? So here are some tips and tricks to help you thrive. So the first one is called notice your stuff. The second tip is change your relationship with anxiety. The third tip is identify irrational thinking. And the fourth is try to rest. And we're going to get into each one. Notice your stuff. Noticing your stuff. The S is for sensations in your body. We talked about that before. How does your body feel? What are you noticing in your body? Which of those feelings in your body, how does it present, impact you? How does it present? How does the anxiety present in your body? The T is for thoughts. How does the sensation in your body impact your thoughts? What are you noticing about your thoughts? Do the thoughts actually indicate danger, or is there a perception of danger? What are your urges? What are you hoping to do? Are you hoping to do one of those maladaptive behaviors, or are you hoping to do something different this time? Notice your feelings. What was that original feeling that you had when you found out that there was a diagnosis? What was the feeling when you identify a trigger? Notice your stuff. The second one was changing your relationship with anxiety. Remind yourself that anxiety is normal. It's your body's way of responding to that predicted threat, realistic or not. Be kind and supportive to yourself. Think of yourself as a friend. If your friend told you that they were anxious, what would you say to calm them down? 3 was identify rational and irrational thinking. And here are some examples. How do I know that the bad thing that I'm thinking about is definitely going to happen? At what point did you decide that that anticipation was 100%? Is there any evidence that it may not happen? How do you bring it down from 100% down? What is the best case scenario? Oftentimes our mind jumps to the worst case scenario. What's the worst thing that's going to happen? And that's what we decide, right? Start thinking about the other end. What's best case scenario? And that helps you think of what's most likely going to happen. Not what you decided in your mind, what's most likely going to happen. What would make this more predictable? If I was a friend and I came to myself for advice, what are they most likely going to predict? What am I most likely predicting for myself? And then you start thinking about what is within my control. How can I identify the components that I can control? There may be aspects that we can't, but we're not going to focus on those because we can't do anything about them. We're just going to focus on what we can control. And the fourth tip is trying to rest. I find that patients have most difficulty resting. Resting is doing relaxing exercises. Sometimes people will tell me, I don't know how to relax. And I'm going to give you a few different examples today. The E is for exercise. Sometimes our minds are moving so much that we need our body to feel exhausted for our minds to calm down. Get some exercise, do something active for yourself. See friends, sometimes that isolation just makes things worse. People tell me that when they're by themselves, that's when their mind keeps moving. That's why at the end of the day, it's the most difficult because you're by yourself. Stay active with your friendships and try new things. You might have done this before and it might not have worked. Try it again, try it differently. You might not have tried each of these things. You might have tried all of them except for one. Try something new. What you've done before might have worked, then continue doing it. But most of the time, it wasn't working, which is why you're thinking about joining today's program. Here are some breathing exercises. This helps us relax. I call it 5-2-5. You're going to breathe in for 5. You're going to hold it for 2. And you're going to breathe out for 5. And we're going to do it together. I'm going to do it one more time with you. We're going to breathe in for 5. And do it out loud so you hear yourself. Do that a couple times to yourself. Great. This is another breathing exercise. It's called alternating nostrils. If you take your pinky and your ring finger together and your thumb, you're going to practice with your nose, holding your thumb to one nostril, and then you're going to alternate using your pinky and your ring finger. I'm going to say it again so you can read my lips. Thumb out, ring finger out, pinky out. Alternate your nostrils using your thumb for one nostril and your ring finger pinky for the other. Breathing in, alternating your nostril, breathing out with your second nostril. Again, breathing in. One more time. Good. This is helpful to help you not only focus, but it also serves as a distraction because it requires some hand-eye coordination, and that distracts your mind from moving. Here's another breathing exercise that I enjoy doing. Oftentimes when we breathe in with our chest. So our chest gets puffed out, but our belly doesn't catch that whole breath. So what we're going to do is we're going to pretend that our belly is a balloon. And we're going to inhale with our stomach. So it expands as we breathe in, and it contracts as we breathe out. We'll do it together a few times. How about 3? Breathe in. As I'm doing this, I'm noticing I put my hands on my belly. So I encourage you to do the same. Feel your belly expand as you breathe in. Last one. Good. Thank you for joining me. This is a good example that I use, especially when I work with children, to help you expand that belly. Notice it come out. Here's a really lovely video that I use for breathing too. We can do it together. You're going to inhale as the shape expands, and you're going to exhale when it contracts. We can do it a few times. Last one. Good. Thank you. Okay. So now we're going to participate in a body scan. I'm going to ask everyone to close their eyes, and I'm going to stop screen sharing for just a moment. Bear with me for just a moment. Okay. So we're going to begin by bringing your attention into your body. It's best to close your eyes if that's comfortable for you. You can notice your body seated wherever you're seated, feeling the weight of your body of the chair on the floor. Take a few deep breaths. As you take a deep breath, bring in more oxygen, enlivening the body. As you exhale, have a sense of relaxing more deeply. If you notice any uncomfortable sensations, focus your attention on them. Breathe into them and see what happens. Visualize the tension leaving your body through your breath and evaporating into the air. You may notice if there's tightness, pain, or pressure. Continue to breathe into that. This can help you release tension in your body now and also be more aware of it in the future so you can release it then too. You can notice your feet on the floor. Notice the sensations of your feet touching the floor. The weight and pressure, maybe vibration or heat. You can notice your legs against the chair, pressure, pulsing, maybe heaviness or lightness. Notice your back against the chair. Take a deep breath. Bring your attention into your stomach area. If your stomach is tense or tight, let it soften. Take a breath. Notice your hands. Are your hands tense or tight, gripped or clutched? See if you can allow them to soften. Now notice your arms. Feel any sensation in your arms. Where are your shoulders? If they're stiff or shrugged, let your shoulders be soft. Notice your neck and throat. Let them be soft too. Relax. Soften your jaw. Let your face and facial muscles be soft. Then notice your whole body present. Take one more breath. Be aware of your whole body as best you can. Take a breath. And then when you're ready, you can open your eyes. Some people like to participate in guided imagery. Guided imagery is when you use your imagination to put your body into a more relaxed state. Just as your body can become tense and stressed in response to thoughts that make us angry or anxious, it can also become more calm and relaxed in response to calming, peaceful, and pleasant thoughts. One of the most basic ways to use imagery to relax is to close your eyes and imagine that you're in a place that's peaceful and relaxing and soothing to you, like a beautiful beach. That hammock is just calling me. It could be a shaded forest or snuggling up by the cozy fireplace. It may be a place that you've actually been to in the past, or it may be a place that you created in your imagination. And guided imagery, you use all of your senses to help in your imagination. Okay. We're going to start with a YouTube video. This is one example, and there's millions. Okay.
You're standing near a waterfall that's cascading down the mountainside. The air is warm and fragrant, with an aroma of sweet tropical flowers. There's the sound of exotic birds. A lush green surrounds you. As you enjoy the warmth of the sun, the sound of the waterfall. Now stepping underneath the waterfall, you feel the water flowing from the top of your head and down your neck, across your shoulders, down your arms and hands, and then into the earth. You experience the water washing away all the tension from your body and your mind. Feeling fresh and invigorated. You step out of the waterfall and in your own time make your way back to the room.
Oops. Okay. So this is the best way to contact the social work department if you're looking for additional support, if you have any questions about today's presentation, and if you just want to talk. My number is 732-390-7750. My email address I had mentioned before, it's social.work@esterahealthcare.org. Thank you. So before we hop into our question and answer, I'm going to ask that you either put your question in the chat or raise your hand out loud, just so I can figure out who's going to be asking the questions, not all at the same time. And at this point, I'm going to turn off the recording.